Good afternoon, ladies and gentlemen. Let me welcome you to this session, which is called How Can Research and Innovation Help to Leave No One Behind in the Post-COVID-19 Recovery? My name is Signe Ratso. I'm Deputy Director General of DG Research and Innovation, and it will be my pleasure to moderate this session. During this session, you will hear first 5 short presentations from high-level speakers who are working in health, in psychology, economy and politics. And they are going to share with us their experience, what has worked and what has not worked so well in order to tackle the pandemic. Afterwards, we will also have a panel discussion. We will also use Slido to interact with you, to know more about you, to collect ideas, to collect your questions. And I very warmly encourage you to participate actively in this discussion, because we'd really like you to share your experience as citizens, how the pandemic has affected you and your families. And certainly this will also contribute to future design of our future research. Now, before I give the floor to the honorable speakers, there will be really a moment for you, dear audience. Be connected to our Slido via the QR code, via browser, with the event code, which is #RIDays30. And the question really is, what has been the biggest impact of COVID on your lives? But while this Slido is continuing, we can already see the first results coming in. I'd like to, the first speaker, who is Dr. Hans Kluge, medical doctor and WHO Regional Director for Europe. And it's my huge pleasure to give the floor to him. And Mr. Kluge will set the scene for this session. And he's going to tell us more about the geopolitical dimension of the policy debate of the pandemic. So Hans, please, the floor is yours.
Thank you so much, and a great pleasure to be on the panel. On the geopolitics, indeed, looking from a pan-European perspective, 53 European member states, we see a lot of geopolitical dimensions, tensions, not at least also with unequal access to COVID-19 vaccines, but we see also tremendous solidarity. What we have been seeing is that mutual blame games make that people suffer and die, but that cooperation saves lives, and that's the only way out of the pandemic. The optimistic take is that crisis foster innovation and really bring societal and fundamental changes. One example, yesterday I was at the biopharmaceutical CEO roundtable in Brussels, and if we think with the speed that vaccines, not one, but the whole set of COVID-19 vaccines have been developed in 1 year, with about 300 contractual arrangements among sometimes previously competing companies. They're produced, licensed, distributed. I mean, this should not be taken lightly. I think that's an enormous silver lining. And the key issue will be to build upon that positive momentum for the future. Today, 32% is vaccinated with 1 dose in the pan-European region, 19% with 2 doses. And the only way to get off the pandemic is what I call VIP approach. The V from variants. We need research innovations on the genomic sequencing, etc. Number 2, we need the I from immunization. Really drastically scale up the vaccination and convince the people who are hesitant and convince them to take the 2 jabs, because Delta variant can break through the first dose. And the P from VIP is about politics, that political decisions are based on science. In a nutshell, we see that European countries with strong primary healthcare and public health, advanced digital health systems, and what I call an appetite for innovations have in general fared much better. We are addressing this through the European Programme of Work, which really looks at what do the citizens legitimately expect from their health authority. And maybe a final word, and I think that another speaker will speak more about this, on mental health. If I think about the innovation and research, we are struggling with lack of data on the mental health. I think that's a huge field to be tackled, because we want our policy decisions to be based on science, really. We need to think medium term and long term, because we know a crisis, a catastrophe like this, there is a cycle of panic followed by a cycle of neglect. Human memory is very short, and I think that's our joint responsibility. Thank you so much.
Many thanks, Hans, for sharing these insights. And clearly, I don't think that anybody can dispute that really the success that we've seen in developing the vaccines in such a record time, but also then producing, distributing them, collaborating, has been a huge success. But there are also some additional lessons to be learned, how namely to share data, how namely to continue this kind of collaboration. Now, before giving the floor to the next speaker, let us look at the results of the Slido poll. I think that when the first results came in already immediately, a different way of thinking was the one which was leading, and also experiencing lockdown, which is now a bit less, but also more time for my family, myself and for my family, and feeling isolated, are all the factors that have been voted by the audience now with different number of votes. But I think this would be a nice also background for the next speakers, also to speak about their research, what their research has already showed. Now I have the honor to introduce to you our next speaker, who is Marit Sibrandi, a professor in clinical psychology at the VU University Amsterdam, the Netherlands, and also director of the WHO Collaborating Center for Research and Dissemination of Psychological Interventions. Marit, what is the most important take-home message of the Respond project that you've been leading? How can we enhance mental health and well-being of vulnerable populations like school children, older adults in times of COVID? What has your research shown? Please, Marit, over to you.
Yeah. Thank you very much, Sinje. My first slide, please. Well, I'll tell you more about this most important take-home message. Thank you very much for the invitation to present on the Respond project, which is a large European research project that we're coordinating from the Vrije Universiteit, Amsterdam, the Netherlands. And it will be focused on improving the mental health, well-being and resilience in the COVID-19 pandemic. And we're already 6 months underway, and we're proud to continue with this for the next 2.5 years, together with 13 other international partners. It's more than 1.5 years ago when most of us heard about Corona for the first time. And since then, of course, our lives have profoundly changed. Among some of the positive things is that it has given us the opportunity to get a glimpse into each other's homes, to see the cat walking on the desk or the children of our colleagues. But unfortunately, and that is what Respond is about, the COVID-19 crisis had mostly negative consequences. The illnesses and loss of loved ones due to COVID has experienced, a lot of people have experienced this. People were very afraid of being infected and still are. And the lockdown measures and economic consequences all have their tolls on mental health. And so far, studies in the general population carried out during the first lockdown period showed that mental health symptoms such as depression, anxiety and traumatic stress and worry was relatively high in the first period. We found high rates, but then decreased when the restrictions were loosened and society was reopened again. We did a study ourselves among 8,000 people, over 8,000 people in the general population. And there we found that over the course of the pandemic, these symptoms went slightly up again in the new lockdown last winter and this spring during the second and third waves. However, as Dr. Kluge also said, we also have to be very careful and anticipate for the long-term effects on mental health. As you see in this figure, the orange dotted line shows that potentially these can be very high. And we know from previous studies that, for instance, economic recession has a vast impact on mental health and also impacts suicide rates. We also know that particular groups in the population are specifically vulnerable for increased psychological distress. Vulnerable groups that have been identified and quite consistently across multiple studies are young people and students, adolescents, people infected by COVID-19 themselves, so people who got the disease, health workers, specifically female health workers, and also minority populations, so people already living sometimes under precarious circumstances, such as refugees, labor migrants, or migrants. Already before the pandemic, only a minority of people with mental health symptoms were receiving any type of formal treatment for this. And this is called the mental health treatment gap. And this is also the case in Europe. Over 100 million people in the European region are suffering from some form of mental illness. And we also know that only 30% in the richest country in the European region are getting appropriate help for this. Which is only 5% in the more poorer countries. And we also know now that in the COVID pandemic, the provision of the available mental health care at least during the first wave of the pandemic, has been severely disrupted. It took time for some mental health institutions to shift to remote delivery of services, digital services, or once lockdown restrictions were eased, to restart services. And that meant that people may have been deprived from services at least temporarily, and which made things even worse. And therefore, it's very crucial that we develop and evaluate effective psychological interventions that we can use remotely and that are also accessible to many people across countries during crisis, such as this pandemic. Next slide, please. So during the past years, the WHO, the World Health Organization, has developed a set of accessible psychological interventions to reduce the treatment gap in crisis-affected populations in low and middle-income countries. But these interventions, they can also strengthen mental health systems in high-income countries, such as in Europe. They can be implemented at low cost, since they can be offered by non-specialist helpers or lay peer helpers under supervision of trained mental health professionals, such as psychotherapists. And one of these interventions that have been developed, you see on the left side of this slide, is Doing What Matters in Times of Stress, which for the Respond project, we adapted into a stress management self-help tool available in multiple languages. And it's accompanied by audio files, and it helps people to reduce stress and to promote adaptive coping and resilience. And it consists of 5 modules that people can access over the course of a period of 5 weeks on their cell phones, and it is supported by trained helpers. But if people require more support after finalizing Doing What Matters, they can then go on to receive Problem Management Plus as a next step, which is slightly more intensive. And Problem Management Plus, or PM Plus, is a psychological intervention. It's already available from the WHO website. It can be downloaded from there, the manual. And it consists of strategies to address daily problems, to reduce stress, to get more active, and to strengthen social networks. And it's also delivered by lay or non-professional helpers under the supervision of a specialized mental health professional. And it can be offered to individuals, but it can also be offered to groups. And it has already been shown effective in studies in Kenya and in Pakistan, and in Syrian refugee populations, also in the Netherlands, to reduce symptoms of anxiety, depression, and improve daily functioning. And within the Respond project, we have adapted PM Plus to use through teleconferencing in case the lockdown restrictions would require us to shift back again to remote delivery. And we will investigate whether the combination of both programs is helpful for people with increased psychological distress. And we will examine this among health workers in Spain, doctors and nurses, staff, patients and family members in long-term care facilities in Belgium, and in migrants and labor migrants in Italy, France and in the Netherlands. Finally, hopefully, and that's what we are eager to find out, these programs prove to be a valuable new asset to our regular mental health care and will help institutions and governments to respond quickly to an increased demand for psychosocial services. For future crises, such as the refugee crisis or new pandemics, this will make us much more shock-proof and contribute to reducing mental health disparities between people in Europe and across the entire world. So, thank you.
Well, many thanks, Marit, for sharing the first results of the Respond project with us. And as we could see, that really there has been quite an impact on the mental health during the pandemic, no surprise, but particularly on some of the vulnerable groups in the society. But I think even more interestingly, we could also see that there are already innovative tools how to cope with this situation and how really to help these people with this kind of issues. Now, before handing over the floor to the next speaker, let me also remind you, the audience, that you also have a chance to put questions to our speakers using the same Slido tool. But now I'd like to turn to our next speaker, who is Elina Kilpi-Jagonen, who is Assistant Professor of Sociology at the University of Turku in Finland. Elina, from the preliminary results of the ERANET dial that you are leading, can you provide an example of the impact of COVID on inequalities? For example, gender and income inequalities. Now, over to you, Elina.
Many thanks. And hello, everyone. I'm very happy to be here today to present to you some of the research that's been coming out of the dynamics of inequality across the life course research program related to social inequalities during the pandemic. And you can put up my slides, please. So DIAL is a research program consisting of 13 international projects that are devoted to understanding the development of social inequalities and how they could be addressed. The research program has been going on for several years now, but with the onset of the pandemic, a number of researchers and projects have incorporated the analysis of the pandemic into their research agendas in order to tackle this highly pressing issue. This new research has centered around three themes. Firstly, inequalities between children, and in particular, how school closures have influenced children's well-being. Secondly, inequalities between genders, especially in terms of the distribution of housework and caring tasks during lockdown, which have influenced the availability of daycare in many countries. And thirdly, inequalities related to labour market attachment and income, as well as the individual's worries about these issues. So today, I want to give you two examples of this research, particularly related to the second and third themes, both of which are also highly linked to potential contributors to the mental health strains of the pandemic. Next slide, please. So on the left here, you can see research results from the UK, where DIAL researchers have analysed the division of housework within couples based on whether there are any children in the household and the age of the youngest child. The figure shows density plots of the woman's share of housework, which in most couples is over 50%. What we can see is, in red, the distribution before the pandemic, in green, the situation around April of last year, in other words, during a period of lockdown, and in blue, the situation around September, in other words, after lockdown. The increasing amount of housework during lockdown in April, in particular, but not solely related to taking care of children, has been associated with more gender equality in most couples, with the largest shifts in couples with children under school age. However, this situation seems to have been relatively short-lived, and the situation in September was already within many families similar to what it was before the pandemic, with on average very slightly more equality within families with either no children or with only school-aged children. Moving to the results on the right, this research concerns feelings of socioeconomic strain in Germany, including, for example, financial concerns. The graph shows different socioeconomic predictors of greater feelings of strain at 3 times time points during last year, namely June, October, and November. What we can see is that in particularly marginally employed individuals tended to feel the most socioeconomic strain, and among occupational groups, the self-employed or freelancers, and to some extent also manual workers. On the other hand, civil servants tended to be relatively sheltered from feelings of strain. Overall, the lower the income level, the more individuals tended to feel strain, and having children in the household was also associated with greater levels of strain. While most of these associations remained relatively stable over the study period, we do see the levels of strain of the self-employed and manual workers being reduced over this period. What these results from Germany highlight is that individuals who were already more disadvantaged were more likely to have experienced and to worry about the socioeconomic consequences of the pandemic, thus contributing to increased social inequalities. This is also likely to be linked to inequalities in the mental health strain of the pandemic. And finally, a more general point from these analyses is that we need to understand inequalities from a dynamic temporal perspective in order to assess how the pandemic and the policy responses to it have been either alleviated or worsened existing social inequalities. In particular, what these types of analyses help us to identify is which are the groups that are potentially being left behind in the recovery, and to whom should we be targeting more support. Thank you for your attention.
Well, many thanks, Elina, for sharing the results of your study. And clearly, as you can see, that inequalities, as we know, exist, and also that the pandemic has also had quite some effect on enhancing these inequalities further. But let us now see what our audience thinks about these issues. Namely, now you have the second question for the poll, namely whether they share the view that COVID has enhanced inequalities and generated more discrimination. Well, we can already see the first results coming on, which is actually 100% of the audience agrees with that. You still have some time to reply, but with that, I'd like to give the floor to the next speaker, who is Andrea Filippetti, Director of at the National Research Council of Italy, see on air, and Associated Professor of Managerial Economics at Luis University in Rome. Andrea, can you tell us how the pandemic has been managed in Italy? Can you give us one concrete example of what that also meant for your family? Over to you, Andrea.
Yeah, well, thank you. Thanks for inviting me. Can I have my slides, please? So I will talk about how Italy managed the pandemic, but with a specific perspective, that of regional governments. You know, we've been looking very much to national governments, the European Commission, of course, playing the major role because they had to manage the borders, mobility of people, and so on and so forth. But we know COVID is not fully aware of administrative borders, so it's not aware of regional borders as well. And in particular, I want to stress the role of subnational governments, especially regional governments. So this is an example of Italy, but it also applies to countries like Germany, Spain, United States, Brazil, which are either federal or decentralized. You know, the main issue here is that COVID had a very much different impact across the space, across territories, across regions. So in Italy, it was immediately evident that initially it struck pretty much in the north, in Lombardy, and then it was spreading in the north, and then eventually it was also going to the south. And then with the second wave, we had a kind of different dynamic. So it was immediately evident that there was a geographic issue to deal with. That is, COVID was differentiated across regions, across spaces, across cities, and therefore there is an inherent weakness in managing this kind of phenomena by just centralizing management. Okay, so just looking at central government, you need to deal with what is going on in the territory. And so what I'm showing you here is what regions did in terms of putting their own budget. So these are regional budgets, thanks to which regions were trying to respond, helping families, helping the business sector, helping the unemployed, social security, and so on and so forth. So, of course, there was a big effort carried out by the national state, national governments, but along with it, and this has been less discussed, along with it, regions were fully aware of their role, and therefore they were trying to put their own money into it. What is interesting here in terms of European environment is that if you look at the red bars, those are the money they were coming from structural funds, okay, from cohesion policy. So what regions were allowed to do was that, okay, we have structural funds, okay, European cohesion policy, you can use that money, you can convert those money into immediate support for whatever you think it is useful, support for families, for productive system, for the health system, and so on and so forth. So regions were quite, swift in converting money from structural funds into public policies. And what is interesting from this chart is that regions from the south, which are usually less efficient, less responsive, and historically, actually they were, you see, Sicily, Campania, and Puglia, those are the three regions from the south. They were quite, faster in putting on the table the larger fraction of financial resources to face the crisis. Now, can I have the second slide, please? The second point I want to make is that what was interesting is that regions were trying to differentiate their responses, their measures. So what you see here is just a linguistic analysis of the laws passed by the regions in terms of the title of the laws. Okay, upper left is at the very beginning, and then down right is after 6 months. Okay, and what you can see here is that regions were helping families, were helping impresas, business, but also that over time you see a lot of differentiation. So just one example, Sardinia, it is island in Italy in which tourism is possibly the most relevant sector in the economy, and that Sardinia was precisely converting the whole money coming from structural funds into support for tourism. So the second message I want to convey is that regionalism was efficient in terms of differentiating the measures in order to better serve the specific characteristics of the socioeconomic characteristics of the territories. Thank you.
Well, many thanks, Andrea, for giving the insights, namely first into the regional differences of COVID in Italy, and also making comparisons with other countries, but also highlighting how also the differentiation in regional responses also then reflected the different socioeconomic impact, and also highlighting the sectors which suffered most as a result of the pandemic. And certainly, I think an important point here is also to bear in mind that the European regional funds also helped in order to deal with that. Now, we are supposed also to have now, before that, let's see the results of the second poll. Now, it's not anymore 100% agreeing with the results of the study that we've been showing, but still the overall majority are agreeing with that COVID has enhanced inequalities and generated additional discrimination. And now, as I said, that you also have a chance to put your questions via Slido. But before that, I'm wondering if now our final speaker, Margarita Marquez, a member of the European Parliament, has joined us. Yes. Margarita, you are with us.
Okay, thank you. That's right. It was not easy, but finally here I am. First of all, congratulations for this initiative. I know that the European Research and Innovation Day is a very interesting and public and very well-known event, and congratulations for one more European Research and Innovation Days. And also thank you for having me here today to share my views as member of the European Parliament. And I'd like to start to say that that time with this crisis, finally, we have a clear European answer to the crisis. And this clear European answer is the creation of the Next Generation EU, the creation of an European fund. And the Next Generation EU is a historic EU instrument by its nature and its design. It is funded by European EU common debt. The European Commission will go to the financial markets on behalf of member states to take money to create this fund. It means is solidarity, is mutualization of responsibilities. It's, in the end of the day, Eurobonds. And when we look to the previous crisis, where each member state went to the financial markets with different interest rates. For example, I remember Portugal paid 7% at the same time that Germany paid 0%. So it means that it created big divergence. That time is the Commission who will act on behalf of the member states. What we want is a level playing field in the internal market and investing in green and digital technologies, in innovation and research, including in a knowledge-based economy and key sectors of the economy that are important to achieve fair, inclusive, and sustainable growth. In this recovery, we can find an incentive for reforms and investments to promote digital innovation hubs. Reforms and investments in the development and innovation, like support for innovation clusters, including between business, research organizations, and public authorities and business networks, primarily benefiting SMEs, that should aim to enhance the growth potential and enable a sustainable recovery of the Union economy. It's why the main part of this fund, it means the RRF, the Recovery and Resilience Facility, that is the main organization of this fund, in the end of the day is how to spend the fund. This RRF is based in 6 important pillars: green transition, digital transformation, smart, sustainable and inclusive growth, including economic cohesion, jobs, productivity, competitiveness and research, development and innovation, and a well-functioning internal market with strong SMEs, social and territorial cohesion, health and economic, social and institutional resilience, with the aim of inter alia increasing crisis preparedness and crisis response capacity. And finally, policies for the next generation, children and youth, such as education and skills. The RRF is a unique instrument to foster economic, social and territorial cohesion by improving resilience and to increase the growth potential of the member states. This pandemic has having an asymmetric impact across sectors of the economy and society. The recovery has been uneven, and therefore the RRF plays a crucial role in mitigating the social and economic impact, in particular on the most vulnerable and affected, women, children, youth. RRF, as I said, is the main pillar of the Next Generation EU. With the RRF, member states will prepare the National Recovery and Resilience Programme, and finally, it's possible to combine reforms and investment in one single instrument. And this approach must be a key point in the framework of the preparation of these national and resilience plans, by governments in dialogue with actors at national level, with social partners, with NGOs, municipalities, regions, and so on. And in the end of the day, member states must have their programs approved by Commission and Council. And this is not enough. It means when the member states have their programs approved and financed by European Union Commission has the capacity with the European Parliament to monitor how these programs are implemented. How? By fair distributing the funds across sectors, societies, and future generations to ensure the highest possible impact on economic and social upward and territorial convergence, prosperity for all, and economic stability. It is an instrument with a forward-looking perspective. It aims to recover the European economies to a strong Europe as a global partner and to recover national economies and invest in future generation. Now it is the optimal opportunity to the implementation of the European social pillar, the European pillar of social rights. Time to deliver based on concrete actions of the social pillar, putting people in the center of the recovery.
Many thanks, Margarita. Well, can you conclude in a couple of sentences? Then we will also have some time for the questions. Thanks a lot.
A few seconds on only to say that we need to be sure that all these plans respect and produce European added value. And finally, it's time to implement fully the RRF. It's time to make this sustainable and inclusive recovery for all. Thank you.
Many thanks, Margarita, of speaking really what we could call the innovative approach in terms of financing as a reaction to the pandemic and really to see how we can recover and be more resilient in the future. But let us look at the questions. I think we have time for a couple of questions to be replied. Say the first one is, if we were about to start all over again, what would you do differently this time? Who would like to take that question? From the regional perspective, Italian? Andrea?
Well, okay, that's big questions. Thanks God we have a few time. I think what we did, the bigger mistakes that was systematically done was to under-evaluate the speed of the exponential law of the way in which the pandemic was spreading across states and across countries and regions. I think this is something for, maybe for, governments, but also for psychologists, the way in which we were systematically underestimating the speed of the pandemic. First, we were thinking something that was happening in China, and then maybe just in a few cities in the northern of Italy, and then we keep thinking that until the whole world was affected, and it was too late. I guess that was one of the most relevant mistake we need to learn from.
Okay, now we also have the question, at which level do you think it's more efficient to act to the pandemic? Local, national, regional, European, global? Well, certainly this discussion is ongoing in Europe. Now perhaps as a neutral observer in that, Hans, what would you say?
Thank you. I would say all levels. Because efficiency is everyone acting basically in tandem. And we see it also now with the inequity in vaccine distribution. What we need is a whole of government and whole of society approach. I established 8 months ago the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, and it's chaired by Professor Mario Monti. And he was telling the fact that we cut budgets in health and health systems, it is now the health policy taking the other policies hostage. And that's why one of the main recommendations is a pan-European health threat council, because there are many mechanisms to work together which work in peacetime, but we saw they did not work in wartime. So we need a pan-European mechanism to have more coherence in policy, be it inside the EU and between the EU and the wider pan-European region, and also to foresight in the future. But maybe final point, that unlike in WHO itself, because we're a federated organization, also in countries, that during an emergency, a central command and control structure is necessary.
Okay, thanks a lot. Now, the next question is, how do you think the National Recovery Resilience Plan should be monitored? By whom? Well, I think it's an appropriate one for Margarita, but if you are short, in 30 seconds, then we also have the time for the final question, which I think would be the appropriate one for our researchers to reply. Margarita.
Okay, yes, this is a key point. First of all, on the approval from the Commission to approve the national plans, the monitoring of the plans must be part of the plan. It means we need to have, and it's why the Parliament created a working group on the RRF. I'm a member of this working group, and we have a lot of hearings with the chair of the task force in the Commission. And our main point is just to discuss how to monitor the implementation of the programs. It means the creation of indicators, the creation of methodologies, and we need to understand that development of the RRF programs are in the framework of the European semester. It means the Commission have the capacity to demand to member states to respect the programs.
Okay, thanks. And now how to deal with the stress levels? Perhaps if 30 seconds both for Elina and Marit, what would be your advice?
To deal with stress levels of the population, you mean?
Yes, how to get back to the normal again. We need a lot of adaptation.
Yes, well, we do need a lot of adaptation for that. And of course, a lot of these factors that are still quite unknown. We need data for this. So what we know about previous crises is that economic crisis, if that is going to be taking place, and that's something we don't know yet. There are projections that it may not be that bad as we expect. But if we do have economic crisis, we can foresee a very fast effect on mental health. And unfortunately also we see that during economic crisis there are cuts on mental health. So in terms of funding for health, so like a pan-European or a global health program, I think it's very important not to forget about mental health in this funding and to keep including it also to boost resilience within our population.
Okay, many thanks. So these were the questions to the panel speakers. Let me give a big thank you to all the panelists, also to the audience for your active participation. Now, what we've seen in this discussion was that even if we were not so well prepared for the pandemic, and we've also seen quite some impact on our socio-economic life, also on additional inequalities and also on mental health. But pandemic has also been an unprecedented test of resilience for society, for the citizens. Today, we can say that we are stronger because we stand together to recover, and we are more united for the future events. And certainly, evidence-based research innovation has been key to control the pandemic, but also to counter the effects, to learn about the effects, and also to find the ways how to counter these effects, and also how to help to prevent their reoccurrence. Thank you very much again, and research and innovation, part of our program, will help us to do that, as well as additional other fundings of the EU. Thank you very much again.